very much, Ruth. And Surrey colleagues in the audience, feel free not to heckle as we go through. Okay, I'm Director of Adult Social Care in Surrey, and one of the things that we recognised really early on, about 3.5 years ago, is we didn't have our act together on dementia, and we needed a joined-up approach, a strategic approach that brought everybody round the table. So that's what we did, and we've got some results to tell you about. What really frustrates me when I come to these sessions is someone stands up and says, oh, it's all wonderful in Surrey, can't you all do this? Actually, this has been a real journey for us, and we've had some, real successes, but we've had some real struggles as well. And I think what we want to do is just say what we've done and then welcome any questions or comments, because I think it's a challenge for us all. A really exciting one, though. And one of the things I just wanted to start with is you won't know this, that Taylor is the second most popular name in Surrey. When we talk at events and ask anybody if they're called Taylor, nobody ever is, but actually it is the second most popular name. And so we've adopted the Taylor family, and we're having a different relationship with the Taylor family. And you'll just see Gwen as a rather elegant lady in her early 70s, who is the grandma in this family who has early signs of dementia. And interestingly, one of the things that we found in social care the last year, our biggest increase in demand has been offering services for people with early onset dementia, and that's one of our priorities for the future. But we're looking all the time at how we're supporting families and how we're working with families in their communities. Our vision is obvious. I'm not going to read it out, but you can see that, and it would be the vision of any system. And what's important is it's the same vision for people with dementia as it is for anybody else. Actually, it's not about offering different services. It's about making sure that people can access the services that are there. And again, it's about making sure that we get this real community-based offer for people, that we skill up communities, we educate people, we skill up staff to be able to respond to people positively. So our dementia challenge is probably the same as most large local authorities, except that people in Surrey, as we will have heard the Secretary of State saying this week, are likely to live longer with dementia. So that gives us a challenge, a good challenge, but actually it means that people will be living longer with greater needs. And at the moment, and certainly when we started on this journey, we've done a huge amount to change that. We had fragmented care, we didn't have a joined-up approach. We still have got a lot of inappropriate admissions to hospital, and we know with the A&E story that we've had this winter that that's probably still happening. And we hadn't got the kind of communication and interdependence that we needed. And any local authority colleagues know that we've got real financial challenges facing adult social care. We alone this year have to find in adults alone 46 million, and that's in advance of the announcement by the Chancellor on the 26th of June, when we think it'll go up by another 10 million. So it's not an easy environment that we all work in. But I think the thing that has really pleased us is the fact that we have all come together to deliver our dementia strategy. And that meant that we did some quite difficult work and quite complex work around what do we want this to look like, what are the relationships that we want to have, how do we use whatever money we've got to pump prime the system to make it work. And how do we tackle some of those relationships. And what our absolute aim is to have dementia-friendly communities that enable people to live ordinary lives in the way that they want to. And we've put a number of things in place to do that. We're particularly pleased with our wellbeing centres and our dementia cafes, where people can drop